I'll just say a few words on the Prime Minister's COVID-19 update and the reported easing of restrictions as of today, actually. Today's Monday the 11th, so as of today. Um, so the message has now changed from stay at home to stay alert. That is kind of the key words. It's a little bit abstract, but apparently the message is now, or the circumstances now, the regulations now, I should say, is that there will be no limits on exercise. There will be people will be allowed to sit down in parks, um, and the government's encouraging people to work in business if they can, as opposed to working at home. And then from June, there's going to be a gradual reopening of primary schools, and then by July, the hospitality industry is going to start getting back on track. This is once again comes down to a big balancing act. I should say, incidentally, Sir Keir Starmer and others have criticised this as being too soon. Um, I have very mixed feelings about that. I honestly don't know if it's the right decision or not. I think we'll only see as time goes on. The danger is, and Johnson acknowledges in his speech that no one wants to see kind of second peak, a second bulk of deaths that will overwhelm the NHS. I imagine a lot of medical personnel will be dismayed by this message. They're thinking from a healthcare perspective, which is totally understandable because we're in the midst of a killer pandemic. But I am sure the Prime Minister is under pressure as well, not only from businesses, but from the knowledge that we may be entering, well, it's being described as the greatest economic recession in this country in 300 years, since basically the founding of the Bank of England in 1694. Um, the world could be entering a recession greater than the Great Depression, which is very, very scary, actually. Um, I've said it before, I'll say it again. I think the 2020s is going to be a very, very turbulent decade, and only time will tell. Hopefully, some of this is hyperbole. Newspapers need to sell, but it's when you consider the lockdown measures have taken an economic toll, you don't need to be an economist to see that that's possibly a plausible situation. Um, so I think the Prime Minister definitely has a balancing act to do. It, I mean, it would be easy to say, oh, Johnson's just being populist by trying to ease the lockdown, but he is under pressure from an economic perspective. Um, I welcome some of these proposals. For example, I think that it was pretty absurd that police were reprimanding people for sitting down in a park. To me, that was overreach. That wasn't, for example, fining people for having parties or unnecessary social contact. Someone sitting down in a park after they've been on a jog, the police should not be fining people for that. So if that's now going to be off the regulations, then A, that's a good thing, and B, police need to respect that. Because the public, I think, resent any idea that there is police overreach because of this pandemic, for the previous reasons I've stated. Nicola Sturgeon's criticised it because she's made the point that the message stay alert is vague. And as much as I don't support her party, she kind of has a point. It is a bit of a vague message. Does that mean stay at home or not? Um, as I understand it, the regulations are still stay at home, avoid unnecessary social contact. But one of the things that are raising, apparently, and I'll need to double check this, is one member from another household can visit you as long as you keep the 2 meter distance. Well, does that mean family members? I mean, if I want my friend to come over, and we both know that we don't have the virus, or we're pretty sure of that, and we, sat 2 meters apart. If we want to watch a film, as we used to do a lot, would we be breaking the regulations? Would he be subject to a fine? Would I be subject to a fine? So there's a lot of question marks, and I do think the message "stay alert" is just a bit vague. Um, I understand that the government needs to, they can't have a big long synopsis as a quick, snappy message, but stay alert is a bit vague. And I think the government needs to be very clear about what exactly people can and cannot do. That is a key part. That's what people need to know. Will they be fined if they do X, Y, and Z? Will they not be fined if they do X, Y, and Z? That's a really important bit, actually, because that is why people are staying at home, because they, A, want to respect others. They don't want to spread, potentially spread the virus, but they also don't want to get fined by the police. Um, the rare occasion I go out, it's for one of the allowed reasons, which is to get food. And I also count that as exercise because I walk to the city centre. Um, I haven't even done much exercise in this time. I mean, I've got dumbbells in my room, so I use those periodically, but I don't jog around the block or anything. Um, so let me know your thoughts. I mean, the difficulty is, and again, I have huge respect for the medical perspective here, but doctors and nurses won't be thinking of the economic side of this. And it's understandable they're on the front line, and huge respect for them. But the economic side is going to be a mounting issue. And the Chancellor's plan, for example, to scale back on the furlough scheme, I don't know the details. I'm not an economist, so I don't want to get into, a situation where I'm talking about things, frankly, I don't know enough about. But it's definitely, we cannot stay in the sort of lockdown that we've been in forever. We just can't. Um, Fears of a second peak are very reasonable fears because it happened during the 1918 pandemic. And that would obviously be, if we get a second peak and then the NHS is overwhelmed again, we're going to get thousands more deaths, and this thing is just never going to end. So I do think that anything that's done does need to be done gradually. But those who are saying there should be no easing yet, they also need to consider that the economic situation is going to get more and more serious as time goes on. And then there is actually going to be a health impact from suicides, the economic hardship that people will experience, mental health problems. These are things that can't be underestimated. And we know that those things happen during an economic recession. So this is a very unique situation. I can't think of a historic precedent because the Great Depression wasn't preceded by a worldwide pandemic. The 1918 pandemic, the 1930s Great Depression, well, the Wall Street crash, there was a 9-year gap there. It didn't come as a result of any restrictions of the 1918 pandemic. At least not that I'm aware. If there was a recession, it certainly wasn't a major one, by comparison to the Great Depression. So this is a unique situation where governments are having to balance their economies with their healthcare. It's a very, very difficult balancing act. And, I have absolutely no envy for the position that Rishi Sunak, Boris Johnson, and other ministers are in. They must be under enormous pressure to get the balance right. Um, Let me know your thoughts.